And I suppose this would be for Dr. Oglaza. So the restrictions they have a week shelf life, right? Just they end December 20th. And I'm wondering if you're sure that's going to be very effective. I know sometimes it takes 2 weeks to even see any kind of effect of any restrictions. And say that isn't effective, have you been in talks with the province about potential stay-at-home orders or lockdowns?
Thank you for this question. So the Section 22 order that's been released today is to provide that immediate impact on breaking the chain of infection in this community. We have seen an unprecedented rise in cases, and over the past several days, we've seen a significant rise in cases of the new variant Omicron. So by implementing these very stringent measures very early or as early as possible and for a limited time, this enables us to get a better sense of the impact of Omicron in this community as the situation is constantly evolving, and will also enable us a little bit more time to bring in more of the other restrictions that are intended to be in place for potentially a longer period of time, and are also intended to reduce the risk of transmission. So we are in constant communication with the province. These additional measures are being designed with the input and discussion with the Office of the Chief Medical Officer of Health, and that will be released either later today or tomorrow in a way of a letter of instruction with appropriate notice for the organizations and community to get adjusted to. But in the interim, we are addressing the dire need to break the chain of infection in the highest risk settings that we've seen, certainly implicated in the spread of Omicron.
Okay, thank you very much, Dr. Oglaza. And I suppose this might be for Dr. Pichora. It's about testing in the community. Obviously, lots of people have been told to self-isolate and to get tested, but unfortunately, there's just not enough tests to go around. I guess what is the suggestion, and maybe this is Dr. Oglaza as well, what is the suggestion for people who can't get a test within the 10-day isolation period? Are they allowed to stop isolating after that 10 days? What is the best advice right now with Omicron in the region?
So I'll take that question because it relates very closely to the new development initiative that's going to be rolled out in the KFL&A region, thanks to our partnership with primary care. And as of tomorrow, we will be making COVID-19 take-home test available through participating primary care offices. These offices, list of these participating offices has been included in our media release and will be available on our website. As this new initiative is being rolled out, because this is probably one of the first jurisdictions, if not the first, that takes advantage of this this way of testing. There will be instructions for patients, for people, how to administer the test, how to properly label it, where to return it. Will be returned back to the primary care office and then sent for analysis at the lab. So please do allow a day or so to get all of these participating primary care offices fully onboarded, but it will be available probably as early for some of these locations as early as tomorrow. And that's going to relieve a lot of pressure on the other existing channels where people can get tested. And our colleagues from the assessment centers will still be available for both for testing and for the assessments. And these other channels would also be available for individuals without access to primary care. But at least those with access to primary care will be able to take advantage of that access through primary care offices.
Thanks very much, Alex. Our next question is from Kimberly Molina. Go ahead, Kimberly.
Yes, thank you. I am wondering, why do you believe that there are so many suspected Omicron cases in the Kingston area now versus the rest of the province? And would you say that you're about a week ahead of where the rest of the province could be?
Dr. Evans, go ahead.
Yeah, it's a great question. And my estimation when we look at what the doubling time is for cases of Omicron has been seen around the world, both in the UK, Denmark, South Africa. I wouldn't say we're a week ahead of the province. I think we're probably maybe about 3 days ahead of the province. So as to why it happened here, I think is just probably a little serendipity. I think there clearly was an Omicron case which resulted in a fair bit of transmission that occurred, and at least the one that we were examining did not seem to have any risk factors like travel, et cetera, that were associated with it. So it pops up, and I think the only surprise was many of us thought it was going to pop up in cities with international gateways and airports, but instead it happened here in Kingston, where we don't have that, although we are halfway between two major airports here in Canada, between Montreal and Toronto. So yeah, I think we're only about 3 days ahead of where the province is likely to be. Okay,
so some I guess a stark recollection. I am wondering too about the hospitalizations and ICU cases. Can you give a bit more insight into who these people are? Are they vaccinated, unvaccinated, older people, younger people?
Gerald, do you want to take that? It's a mixture. Maybe I'll start and Gerald can continue. We've certainly noticed an increased rate of hospitalization compared to other centers, and for several days now, we've had the highest number of COVID-related critical illness cases in the hospital of any hospital in the province. And we attributed that to the effects of Delta and the combined immunization rates or immunity rates due to vaccination and previous infection. But then things just accelerated in the past week, and I think the Omicron is the explanation for that. And we do have a mixture of vaccinated and unvaccinated patients in hospital. I think Gerald can give you some additional information. You know, the mix changes daily, so you can't really put too much on this, but generally the vaccinated patients are older and have significant medical comorbidities. That's a general observation.
How about in the ICU specifically? Sorry to interrupt. I just kind of wanted to clarify that particular part.
Sorry, what was that last bit?
In the ICU specifically, is it mostly older people or the unvaccinated or vaccinated?
It's a mixture of all, but the mix is the same as I just mentioned. The ICU patients who are vaccinated tend to be older and more medically fragile.
Yeah, Dr. Pichora has it bang on in terms of what we're seeing, which is very typical of the skew. But I would reinforce that what we're looking at with hospitalizations at the moment are chiefly Delta patients. So as everyone knows, we had an upsurge in Delta long before we saw the impacts of Omicron. And as Dr. Pichora very carefully emphasized, that upward slope is just steepened upward because of Omicron. But right now, to the best of our knowledge, with the last thing we do not have any Omicron patients in our institution, but we are waiting still for some whole genome sequencing still to be done. And this is primarily due to Delta.
Thanks very much, Kimberly. Our next question comes from Jessica Foley. Jessica, go ahead.
Oh, good afternoon. I'm here on behalf of Kingstonist. And we have a question for Dr. Oglaza. All right, let's see. Okay, so it's about how we seem to have such a high rate and right now, and Omicron seems to have taken hold, as we just talked about. But we also had, if we're right, an AstraZeneca vaccination pilot early on. And Chris here says, a recent report from UK HSA shows that 2 doses of AstraZeneca offer less than a 10% protection against symptomatic Omicron if that person is 25 plus weeks since their last dose. And then a Pfizer booster would increase that protection. And we're just wondering, could that be part of this high rate that we're seeing if we did have that pilot, which we're not 100% sure on? And so then would a booster of Pfizer sort of help us out here?
So the short answer is no. This would not be linked to this current surge, because that current surge, 65% of cases are between the ages of 18 and 24, and 25% of the cases are between 25 to 39. So none of these populations would be eligible for the AstraZeneca vaccine. Most of the individuals who are in this group would have been immunized with the mRNA vaccine, and mostly with Pfizer. So while this is a valid question to what are we going to see into the future, but there's no way to answer that now, and certainly the surge seen right now could not be explained by AstraZeneca.
Okay, that makes total sense. Do we know if that's, if that is a thing, like that people who had AstraZeneca should be looking for a Pfizer booster?
I believe that's part of the strategy already with the third dose boosters that we have in this province for individuals. Right now, as of today, 50 years of age and older, we have openings and offer immunizations with the third dose boosters, where they're highly recommended. And this is one way of how we can prepare ourselves for this upcoming wave of the Omicron variant. And those who would have received AstraZeneca in the past would be now eligible for the third dose booster with the mRNA vaccine.
Thanks very much, Jessica. Our next question is from Holly Mackenzie Suter. Could you go ahead, Holly?
Hi, thanks. I'm with Canadian Press. I wanted to ask you guys if you have an estimate of how many cases currently are attributed to Omicron. Like, is there an estimated number of under investigation? Or I'm wondering if you think this is at the point where all new cases are probably Omicron.
So I can answer that question. When we look at our reported COVID-19 cases, we receive from the lab information about this one parameter, which is the S gene dropout, and that is something that's considered indicative for the Omicron variant. And of those, at this point, as of 7:30 this morning, we had 263 cases within the KFL&A region, and that is. Now, we are on track for Omicron to become a dominant strain in this region. At this point, it's probably around or just above the 50% mark for all of our COVID-19 cases. And this number is changing as results are coming in. So we are on track to have Omicron being the dominant strain.
So I guess I have another question, but I'm just wondering if you have more of like a on track, how soon that could happen. And I just wanted to ask one more thing about, after talking to experts this week about the Omicron wave and what we can kind of expect to happen, there seems to be some consensus that at some point, probably soon, testing and contact tracing resources are going to be maxed out, and just it won't be possible for everyone to get a test. And based on what I've heard earlier in this press conference, I'm wondering if you think that is already happening in your health unit, if people are waiting, over a week to get a test, and what kind of planning are you doing to deal with that situation?
So in my understanding and my knowledge is that the lab capacity for testing is still ample, and we are able to continue processing the tests. So this is the reason why we expand the opportunities and avenues through which people can get that test collected and sent to the lab. So that's why the initiative with involving primary care partners in administration of kits for take home and self-testing, self-swabbing by patients. In my understanding, the main challenge that might have been in the past was with maybe the either availability of appointments or other issues with booking appointments, but that my colleagues probably would be better to comment on that.
Yeah, I would clearly say that we have right now a capacity regionally and locally to do somewhere upwards of about 3,000 tests a day. But the limiting issue is getting swabs into people. And as Dr. Oglaza commented on, it has to do with the assessment center trying to process that number of individuals. And as Dr. Oglaza has pointed out, I mean, sort of strategies to get self-administered swabbing done and then the drop off of the test so they can get to the lab for PCR testing is currently what we're doing. And we should be able to deal deal with that in the next little while. But right now, as everyone knows, the system is under incredible amount of stress. Staffing out of an assessment center and staffing places where people can get the swab done by someone who's a professional is really the rate limiting step. We do have a capacity for doing the tests, but it's getting the tests done, and that's why the self swabbing type tests with a drop off is really one way to get around that.
Thanks very much, Holly. Our next question comes from Peter Hendra. Go ahead, Peter.
Yeah, I was just wondering if Dr. Pichora could give us an update on what's happening with the ICU in terms of capacity. Are you considering more transfers, or what's happening on that front?
Well, we're holding our own at the moment. There were additional transfers over the weekend that went out of our ICU. Actually, they went out of our critical care patients. They were new admissions that we transferred out before they actually made it to the ICU because of the impact on ICU. Staffing pressures remain part of the mix. As you know, everywhere in the system, hospitals are stressed with staffing shortages, and that's part of the factor in terms of managing the workload. And in general, patients with COVID in the ICU who are also being ventilated require much higher levels of resources to manage them, and that puts additional stress on our staffing. So our numbers are fairly steady. I think we have 22 or 23 total patients in hospital today that have active COVID, but we probably have another 10 or so who have recovered or are cleared from COVID, but still quite ill. Some of those are in the ICU as well, adding to that pressure. So it's not purely the active case count that has an impact on the hospital.
Thank you.
If Peter doesn't have a follow-up question, we'll move back to the top of the list for Kimberly. Kimberly Molina, please go ahead.
Oh, sorry, I forgot to lower my hand. I'm good, thank you.
No worries. Alex, do you have an additional question?
I do, yeah. It's like a two-part question. So just to follow up to Peter's question there, how many patients were transferred out this weekend? And also, I heard from someone that the hospital is currently in a life or limb status, and I was wondering if you could explain what that means.
Sure. I believe there were two transfers out over the weekend within the region to hospitals in Brockville and Belleville. Fortunately, they had some capacity. We've been on and off life and limb bypass for several weeks now during the fall, just because of overall pressures. And this is not exclusively related to COVID. We have been seeing increasing pressure through the emergency department of a variety of medical conditions. We're seeing, as are other hospitals, patients are coming in high numbers and generally sicker than what we're used to seeing in the past. And that's put a lot of pressure on the hospital. And as well, flow out of the hospital has not kept up with that demand. We've got significant numbers of ALC patients, a lot more than we had last spring, and that's another factor. And so life and limb just means that we're triaging patients at a different level and trying to be very selective about the patients that need to come to KHSC because we're the regional tertiary hospital, whereas cases that could be managed in other neighboring hospitals, we may try to redirect them there if that's possible.
Thank you very much.
Next up, we have Megan. Go ahead, Megan.
Yes, hi, it's Megan Ogilvie from the Toronto Star. You've all done a great job answering a lot of the medical questions. This one is about if you have any advice for the Queen's University students who are trying to figure out what to do in the coming days with their courses and primarily returning to home. I think this would be a question for public health. What is the message for Queen's students whose lives and schedules are so disrupted right now?
Our message to the community of students before heading home is to seek testing prior to departure and be mindful of the potential risk that they might have been exposed while residing in this community. And when they are heading home, if they already headed home and haven't gotten tested prior, our recommendation is to get that test as soon as possible. And also, the message remains the same for anyone in this community, anyone for that matter in the province, is to be very diligent about testing for symptoms. And if someone is experiencing symptoms, even the mild ones, the message and recommendation is to self-isolate and seek testing. What we have seen previously with Delta in this community, and now we're also seeing with the cases of Omicron, is that the vast majority of individuals infected would have very mild symptoms. So specifically for the student population, for younger adults, anyone in these younger age groups, all they may experience is a runny nose, nasal congestion, things that may not really seem like much to them, but this could be the sign of infection and they could be transmitting it to others. So being that extra vigilant about screening, not engaging in social interactions when symptomatic, is something that we strongly recommend, and specifically for those heading home, getting tested before is our advice at this point.
I'd like to jump in with a follow-up question. In your discussions with the Chief Medical Officer of Health, are there concerns that, I know that Omicron is becoming, or will soon be dominant right across the province, but are there concerns with Queen's University students going home to other parts of the province, becoming spreaders to their communities?
Well, the main important factor here is that Omicron's made it to North America, has spread throughout the world, even prior to any of the measures being implemented. We had our first case in Kingston, someone who might have been symptomatic or was symptomatic already with the Omicron variant, just around the same time as the World Health Organization notified the world of Omicron being a variant of concern. So the containment of this situation to the KFL region is not likely to impact the situation in other parts of the province. And as Dr. Evans mentioned earlier, we might be just a few days ahead of other parts of the province, and whether or not individuals stay here or go home, that situation is already actively evolving and unfolding in other parts of the province. But what we can do is, on the individual levels, those individuals who are still here, part of the community, and they're thinking about heading home, is to take necessary steps to protect the loved ones and home. And that happens on the individual level where everyone will make these decisions. But as far as the impact of this on the entire province or other communities, unfortunately, it probably wouldn't have much impact because this variant is already in Ontario.
Thanks very much, Megan. Next question is from Emily Chatwood. Emily, go ahead.
Hi there, good afternoon. I'm Emily with 88.7 My FM in Napanee over here. My question is, I'm wondering, of the local COVID-19 cases that are in hospital, are they majorly in Kingston Hospital and in Kingston Health Sciences Center, or are there any, say, here in Napanee at the Lennox and Addington County General Hospital?
Would one of our panelists be able to take that, or shall we ask L&A County Hospital on a separate, perhaps, email?
Yeah, I think you probably have to talk to L&A themselves. We, I look at the numbers that Public Health has, and I look at our numbers in there. It can be a little bit difficult to sort of, because some of the ones that were now recovered, as Dr. Pichora pointed out, are still considered COVID admissions to hospital. So they probably need to reach out to L&A to ask them what their numbers look like.
Emily, we can take that offline. Did you have any other questions for the panelists?
Yeah, I have one more question that's kind of a broad feeling kind of thing. A concern that some people locally have brought to me is the fact that last year around this time, cases weren't as bad. We were locked down. and now we have the Omicron variant, things are surging. Is there a possibility, I know this is like the Ontario provincially, but do you feel that possibly we could go into another lockdown?
I imagine this is the question for me. So we've seen that the lockdowns and these broader public health measures were necessary in other times of this pandemic, and certainly they would not be necessary looking at the Delta variant, because with the Delta variant we had that predictable vulnerability of those unimmunized, and that really removed the need for lockdowns. We had the very specific measures with the proof of vaccination that was intended to prevent transmission in those maybe higher density, higher capacity settings. With the Omicron, we're still in very much of the unknown. We don't know how much of the impact it will have on the population as a whole, but because it's also more transmissible, we don't know how much how much impact these broader public health measures will have. These broader public health measures are probably the only tool we really have in addition to immunizations, and really the focus and the emphasis is on those third doses for the vulnerable populations, people who are 50 years of age and older, people with comorbidities, those who are already eligible for boosters. We really want and need to get these individuals immunized as soon as possible. So that's the key strategy here. In terms of additional measures, I've introduced measures in Kingston to address specific patterns of risk and spread that are intended to really get a better control of the local situation. Whether or not these measures would be appropriate or applicable for the rest of the province, it's impossible to say right now. But my understanding is that there are discussions, and some other jurisdictions already moved ahead with broader capacity limits and distancing requirements, and that's something that's the route that we will be taking in Kingston as well, in KFL&A region as well. Though these are the measures that are intended to balance that reduced risk or reduced likelihood of interactions leading to transmission, with the need to preserve various vital function of the society in our community. So we may not be at this point. We may not have that dire need for a lockdown at this point, but we certainly have need for some very specific measures to reduce the social interaction and minimize the risk of spread.
Thanks very much, Emily and Dr. Oglaza. Dr. Pichora, are you able to stay on with us a little bit longer, or do you have to run?
I have another meeting starting. If there's a couple more questions, I can stay on.
Sure. Does anyone have specific questions that should be prioritized, Holly, Alex, or Kimberly, to Dr. Pichora?
I do.
Okay.
I do.
All right. So let's start with Alex. Alex, if you could just go ahead with one question so we can squeeze both in.
Sure, absolutely. So obviously you sent out something today about hospital capacity being stretched. I wonder what are the what will it look like when the hospital gets overburdened? What are those hallmarks of, okay, things are really bad now and we need to do something drastically?
Well, so hospitals being in surge is nothing new, and we've been there pre-pandemic. So this is something that just changes the dimension and adds to the stressors, I guess I would say. And staffing shortages broadly in the system are contributing to this, and that affects not just hospitals, but home care and long-term care as well. It all adds up. So what does it look like? We have more patients in hallways. We have in the ICU situations where we really have to look carefully at the ratio of our critical care nurses to the critical care patients, especially those that are on ventilators, and try to maintain a safe ratio between those resources. And that was the kind of thing that triggered our reach out to Ontario Health last week to take advantage of the entire system for support. And we were a reciprocal supporter of that back in the spring, and we're really pleased that the system was able to help us this time, because although hospitals are stretched in the other communities, they don't have the same COVID burden that we have in that dimension at the moment. And so hopefully this is a fairly temporary situation for us, but we don't really know. And, you know, it's not just about the patients we have in hospital today. We're a regional trauma center, and we need to always be looking forward to the, you know, the possibility that we might get an unexpected trauma case or more in tonight or tomorrow. And we're still wanting to continue providing other essential non-COVID related care. In contrast to previous lockdowns, we're trying not to stop all of our elective surgery. We're trying to maintain complex cancer surgery, cardiac surgery, neurosurgery, and many of those cases require critical care as well. Not all, but quite a number do. So we're trying to juggle all of those priorities. Does that help?
It is very helpful. Thank you so much.
Okay.
Thanks, Alex. And was it Kimberly that had the question for Dr. Pichora?
Yes, and it actually touches basically on what you were just mentioning at the end of your comments. Mm-hmm. What effect are the current COVID-19 hospitalizations having on other acute or elective medical treatments, you know, such as cancer surgeries or hip surgeries? You sort of touched on this briefly, but I'm hoping you can expand on your comments.
Yeah, so this current surge hasn't had any immediate effect yet, and we're hoping that it won't. We're still not ramped up back up to 100% of all activities compared to pre-COVID, although we've come a long way in that journey over the last several months, and we certainly hate to take any backward steps now. So it's a real balancing act to try to maintain procedures, surgical flow, and essential clinic appointments too. We know the impact of deferred care and the negative consequences. You're all reading articles in the media about people showing up late with cancer diagnoses and other things like that. And we really want to minimize any more of that. So we'll try our very best to keep our regular care going and juggle that with the COVID stress.
Thanks very much.
Can I do a quick follow-up?
Yeah, sure. If Dr. Pichora has time.
Sure.
I just wanted to ask what would be the point, like when will it not be possible to keep up with current acute and elective surgeries given the rise in cases?
So it's really hard to say that there's one single indicator for that. But you'll remember back in the spring, in order to create additional ICU beds, we had to redeploy staff. And we're now thinking about what staff redeployment could look like if things continue to accelerate. And so that was one of the significant factors that had an impact on our ability to continue surgery and other non-COVID related care. We're not there yet, and we hope we don't go there.
Thanks very much, Dr. Pichora.
I think Dr. Evans has a follow-up.
Yeah, I was just going to say that, you know, I think what's really pivotal here and why it's important that Dr. Oglaza and Public Health have brought in their measures at the moment is to understand that our staff, as members of the community, of the KFL&A community, they get infected primarily out in the community. And when you have high community prevalence, our staff members, as members of those communities, are at risk. And so that really puts staffing under a fair bit of pressure because we need to continue to do the operations, and we do that as safe an environment as possible by screening, testing, working with what we can in dealing with staff. And we, of course, don't like to see outbreaks occurring in the hospital units because that can impact on the availability of a bed, never mind a staffed bed. So that's why these measures that Dr. Oglaza and the other regional health officers have brought into place are really super important, because that's where our staff are most at risk. When they're outside of the hospital setting, that's where they're going to get infections.
Thanks very much, Dr. Evans. Dr. Pichora, did you want to stay on? Oh, no, thank you very much for joining us.
Thanks very much. Dr. Evans can field all of the hospital questions, I'm sure. Take care, everybody.
Thank you. Our next question is from Holly. Hi, Holly. Go ahead.
Hi. Yeah, I just wanted to double check on the time that you expect Omicron will become dominant? Like, are you thinking it'll be a couple days? And then I wanted to ask as well about capacity for ramping up boosters, like if it were to come down that we open that up for all adults sooner than the January 4th.
Well, I can probably at least pitch at you what we know from other jurisdictions and the dominance. By this time next week, there's no question Omicron will be the dominant variant. It took all of about 24 days in South Africa from Delta to drop to almost zero and for Omicron to rise. So this is the speed related to this fact that this virus seems to be able to outcompete Delta. So I would expect by this time next week, it'll be dominant. As to the issue, if you want to define dominance as anything over 50%, we may very well be there at the moment.
Thanks, Holly. Did you have a follow-up?
Yeah, my follow-up was just about the boosters and what the capacity would be in Kingston to ramp up quickly and start, offering to more than just the 50 plus open today, because I think we understand the province is considering that maybe sooner than next month.
Certainly. So the priority is the 50 years of age and older population because of the underlying increased risk of severe outcomes of COVID. So this is the population that's an absolute priority to protect with the third doses. And that's where our capacity and efforts will be focused for the next 2 weeks. In terms of opening up additional appointments or capacity for additional groups that are made eligible by the province, we'll work with that and ensure that there is that capacity in this region. But I wanted to emphasize the need to prioritize the 50 years of age and over individuals for boosters. They are the ones who are most benefiting from the booster, but also the ones who are from most risk from potentially unknown impact of the Omicron variant.
And I would just add that currently we're exploring what was done back in the summer when we had very large capacity for vaccinating people. People remember how many people were able to do daily. Some of that involved outreach and assistance from, for instance, the medical faculty, the Faculty of Health Sciences at Queen's University, as well as volunteer physicians and others who are out there and available. So those are currently being very actively explored to try and increase our vaccination capacity. I've said oftentimes that we need to have testing capacity as it was in the spring of 2020, and we need vaccination capacity like it's the summer of 2021. And we're moving as quickly as we can, certainly from the hospital perspective. And I know I can speak somewhat to say that the Faculty of Health Sciences at Queen's University, with its nursing and medical students and other health professionals, the rehab groups are willing to sort of chip in, and we're just sort of seeing where that goes. The challenge we have, of course, is the holiday season's upon us, and everybody needs a bit of a break right now. I certainly could do with one myself, but yeah, that's what we're working on to try and help Dr. Oglaza with that sort of upswing of capacity to vaccinate individuals.
Thanks very much, Holly, for your questions. Just before we move on to our next question from Paul, I just thought I'd give an update. We do have our case count in just now, and there's since last Friday's update, we have 359 new cases and 908 active cases. With that information, Paul, we move next to you. Go ahead, Paul.
Hey there, I'm with Global News. I was wondering that you had said earlier that basically the Section 22 order is meant to bridge the gap between now and other measures. We were kind of wondering, are those measures going to be provincial or local, or what are they going to be?
So these additional measures that I referenced earlier, these are the local measures under the local letter of instruction, and they will be introducing some broader distancing and capacity requirements. Section 22 order is intended to be an immediate effect to break the transmission in some of the high risk settings.
Paul, do you have a follow-up question?
Yes, and of the, you'd mentioned earlier 263 cases of Omicron, are those suspected or confirmed?
So the case of Omicron I mentioned are based on that initial screening, but Dr. Evans will likely have more to add on this.
Yeah, I definitely they're what we would call suspected because they have this S gene target failure or S gene dropout. The final determination of them being Omicron we call whole genome sequencing, and it takes our laboratory, and we are one of the few laboratories across the province that has capacity to do whole genome sequencing. We're doing it as rapidly as we can, but I will tell you right now, it takes somewhere between 5 to 7 days to get a really reliable signal from the whole genome sequencing to confirm that it's Omicron. But the only other variant that showed this S gene dropout was Alpha, and Alpha has pretty well been wiped off the face of the planet. So we're assuming right now that all these S gene target failures are Omicron.
Thanks very much, Paul. I've received a question from Avis Favreau from CTV National News. Just a confirmation, earlier it was mentioned that the serious cases are all Delta. Is that correct?
That's right. I've checked with our sequencers and looking at the cases that we have in hospital. We have not detected an Omicron case that's in the hospital at the moment, but you have to be very careful with that piece of information, recognizing that on average with COVID-19, you start to see a rise in hospitalizations about 2 weeks or so after the rise in the actual cases that are occurring in the community. But at the moment, what we're seeing is the effect of that rise in Delta that started our fourth wave here in the southeast part of Ontario, which is now steepened with the Omicron cases. But that's currently what we're seeing, and just waiting for further confirmation of that.
Thanks very much. The only remaining hand is still Paul. Paul, do you have another question?
No, I just forgot to put it down.
Okay, I do not see any other hands. If there's any other questions, please raise your hand. Okay, is there anything, Dr. Oglaza, you'd like to add? And then I'll ask Dr. Evans if they'd like to add anything else.
Yes, thank you very much. The main message for our eligible population of the 50-plus-year-old individuals is to check our website. There's booking links to different clinics run by public health, clinics run by our partners from primary care. There's going to be a lot of availability for appointments in the coming days. There's some massive clinics, drive-through clinics planned for this upcoming weekend, and please do take advantage of that. Go through our website, look at the links and locations, and if you're eligible, which is 168 days from your complete immunizations and either 50 plus years of age or someone with other eligibility criteria, all of that is on our website. Please do take advantage of this opportunity and get that full protection from the third dose of COVID-19 vaccine.
Thanks very much. Dr. Evans, do you have something you'd like to add?
Yeah, a couple of quick things, although Dr. Oglaza took the most important point, which is if you're eligible for a third dose, get your third dose. Really, the issue I think everyone has to understand, even if Omicron pans out to be, say, less virulent or perhaps as equally virulent as Delta, the rise in transmissibility is going to produce more cases that have serious outcomes. And so we need everyone to do their part with the assistance and guidance of public health to reduce case numbers overall and reduce transmission so that it does not impact the health system. I think people have this view at the moment that, we're seeing signals that it doesn't look that bad, but it can look bad if you drive up the numbers. If numbers drive and this variant has the capacity to do that, then we are going to see a rise in cases elsewhere. And I keep going to a baseball analogy. I think we all felt that Delta was a fastball and we were waiting for it, and instead it pitched a curveball at us. And so we have to adjust and pivot. And I would expect to hear and see a lot more things changing in the future in a number of organizations as we deal with Omicron.